Hey everyone, welcome back. I'm Naomi Chapelton, and today we are going to talk about something that I know so many of you have been asking me about for months: cataracts. That slow, creeping cloudiness that quietly steals your vision, and the natural approaches that might actually help turn things around. Now, the title of today's session is a little dramatic. I'll admit that up front. This fruit kills cataracts overnight. I'm not going to stand here and tell you that eating one piece of fruit before bed is going to have you waking up tomorrow morning with perfect 20/20 vision. That's not how biology works, and I respect you too much to pretend otherwise. What I am going to tell you is that there is genuinely fascinating science around certain fruits and their compounds, and that science points towards something real. So let's dig in properly. Let's talk about what cataracts actually are, why they develop, what the research shows about nutrition, and which specific fruit keeps coming up in the literature again and again. And yes, we will talk about eating it before bed, because there is actually a reason that timing might matter. All right, let's start at the beginning. Your lens, the transparent structure sitting just behind your iris and your pupil, has one job: to focus light cleanly onto your retina. For that to work, the lens has to stay clear, perfectly optically clear. And it manages this remarkable feat through a combination of specialized proteins called crystallins, antioxidant enzymes, and a very tightly regulated internal chemistry. No blood vessels pass through the lens. It gets its nutrients from a fluid called aqueous humor, and it relies on that fluid to deliver everything it needs and carry away waste. When things go wrong, when oxidative stress accumulates, when those crystalline proteins start to misfold and clump together, you get cataracts. Cloudy patches, scattered light, blurred, hazy, washed out vision. The world starts to look like you're peering through a frosted window. Now, cataracts are the leading cause of blindness worldwide. Over 94 million people are visually impaired because of them. Surgery is effective, absolutely. Modern cataract surgery is one of the safest and most successful procedures in all of medicine. But surgery is not accessible to everyone. It costs money. It requires infrastructure. It requires recovery time. And even in places where it is accessible, a significant number of people either delay treatment or simply never get it. And here is the deeper issue that nobody talks about enough. Surgery removes the clouded lens. It does not address the underlying biochemistry that caused the problem in the first place. If the oxidative environment in your eye is not corrected, if your nutritional status remains poor, the processes that led to the cataract are still running. So whether you are trying to prevent cataracts, slow their progression, or support your eye health after surgery, nutrition is absolutely in the conversation. And the fruit that keeps rising to the top of that conversation is the bilberry, Vaccinium myrtillus, a small, dark, intensely pigmented relative of the blueberry, native to northern and central Europe, and traditionally consumed across Scandinavia and Eastern Europe for centuries. Let me tell you the story that got researchers interested in bilberries and vision in the first place, because it's a good one. During World War II, British Royal Air Force pilots reportedly noted that their night vision improved after eating bilberry jam. Now, anecdotal, yes. Wartime lore, possibly. But that observation sparked decades of scientific curiosity. And what researchers found when they started looking at bilberries seriously was remarkable. Bilberries are extraordinarily rich in a class of polyphenols called anthocyanins. These are the pigments that give the berry its deep blue-black color. And anthocyanins are not just pretty molecules. They are among the most potent antioxidants found in nature, and they have a very particular affinity for ocular tissue. Studies have shown that anthocyanins are selectively taken up by the retina and by the lens of the eye. Your eye actively concentrates these compounds. That alone should tell you something about how important they are to visual function. So what do anthocyanins actually do? A lot. First, and most importantly for our conversation today, they neutralize free radicals, reactive oxygen species, the unstable molecules that cause oxidative damage to the crystalline proteins in your lens. Remember, oxidative stress is the primary driver of cataract formation. When crystallines oxidize, they unfold, they aggregate, they form the cloudy deposits that scatter light and destroy your vision. Anthocyanins intercept that process. They donate electrons to free radicals, neutralizing them before they can damage your proteins. Multiple studies in laboratory settings have shown that anthocyanin extracts from bilberries can inhibit the oxidation of lens proteins in a dose-dependent manner. The more anthocyanins present, the more protection conferred. Research published in peer-reviewed ophthalmology journals has demonstrated that bilberry extract can reduce oxidative markers in lens tissue and preserve lens transparency in conditions designed to simulate the oxidative environment that leads to cataracts. In animal models, diets supplemented with bilberry extract significantly reduced cataract severity compared to control groups. Now, I always want to be careful when translating animal research to human recommendations. But the biological mechanisms are consistent across mammalian systems, and the safety profile of bilberries is excellent. These are not exotic pharmaceutical compounds. These are food. Second, anthocyanins support the health of the tiny blood vessels that feed the structures around your eye. Even though the lens itself is avascular, the tissues surrounding it, the ciliary body, the trabecular meshwork, the retinal capillaries, are all dependent on healthy microcirculation. Bilberry anthocyanins strengthen capillary walls, reduce permeability, and improve blood flow to ocular tissues. This is part of why bilberry has also been studied in the context of diabetic retinopathy and glaucoma, not just cataracts. Third, anthocyanins have anti-inflammatory properties. Chronic low-grade inflammation is increasingly recognized as a contributor to cataract development, particularly in older adults and in people with metabolic conditions like diabetes. Bilberry extract has been shown to downregulate inflammatory cytokines and reduce oxidative inflammation in a range of tissue types. Fourth, and this is particularly relevant to our discussion, bilberry anthocyanins support the function of glutathione, your body's master antioxidant. The healthy human lens contains among the highest concentrations of glutathione of any tissue in the body. Glutathione is absolutely central to lens maintenance. It directly reduces oxidized proteins, regenerates other antioxidants, and protects the pumps and channels that keep the lens clear. Cataractus lenses consistently show dramatically depleted glutathione. Bilberry anthocyanins help maintain glutathione levels and support the enzymes that regenerate it. This is not a small thing. This is addressing the fundamental chemistry of cataract formation. Now let's talk about the before-bed timing, because I promised we would. During the night, your eyes are closed. There is no incoming light. The intense photochemical activity that occurs in the retina during the day, the cascade of reactions triggered by photons hitting your photoreceptors, all of that slows down significantly. This means that the oxidative load in your eye drops at night, and that is exactly when repair processes can run most efficiently. Your body does its cellular maintenance during sleep, protein repair, cellular detoxification, antioxidant regeneration. All of these processes are more active when your system is not busy processing light and managing the demands of wakefulness. If you consume a concentrated source of antioxidants in the hours before sleep, those compounds are circulating and available precisely when your eye's repair mechanisms are most active. The anthocyanins from your bilberries are being absorbed and reaching ocular tissue just as your eyes are getting their best opportunity to clean house and repair damage. Is this overnight? In the literal sense, no. Cataracts do not dissolve overnight. What happens overnight is that the conditions for repair are optimized. And if you create those conditions consistently, night after night, week after week, the cumulative effect is meaningful. This is the honest version of the overnight promise, not magic, optimization. Timing your nutritional support to align with your body's natural repair cycles. That is smart. That is science-based. And it is something you can actually do. Now, bilberries are the star of today's conversation, but I want to give you the full picture of nutritional support for cataract prevention and management, because bilberries work best as part of a broader strategy. Lutein and zeaxanthin are two carotenoids that are absolutely essential to eye health, and that are found in high concentrations in the lens and retina. Multiple large-scale epidemiological studies, including the age-related eye disease study, known as AREDS, have shown that higher dietary intake of lutein and zeaxanthin is associated with significantly lower rates of cataract development and progression. The best food sources include dark leafy greens like kale, spinach, and collard greens. Vitamin C is present in the aqueous humor of the eye at concentrations 15 to 20 times higher than in blood plasma. Your eye is essentially bathing your lens in vitamin C, using it as an antioxidant shield. Deficiency in vitamin C is strongly associated with increased cataract risk. Citrus fruits, bell peppers, kiwi, and strawberries are excellent sources. Vitamin E is a fat-soluble antioxidant that protects cell membranes in the lens from oxidative damage. Nuts, seeds, and avocado are good sources. Omega-3 fatty acids, found in fatty fish, flaxseed, and walnuts, support the overall inflammatory environment in the eye and contribute to the health of the lacrimal glands and tear film, which matter for overall ocular surface health. Zinc is a cofactor for antioxidant enzymes in ocular tissue and plays a role in vitamin A metabolism, which is essential for visual function. Pumpkin seeds, legumes, and meat are good sources. And of course, blood sugar management deserves a special mention. Diabetes is one of the strongest modifiable risk factors for cataracts. The lens is extremely sensitive to high glucose concentrations. When blood glucose is chronically elevated, glucose enters the lens through non-insulin-dependent pathways and gets converted to sorbitol by an enzyme called aldose reductase. Sorbitol accumulates in the lens, drawing in water, causing osmotic stress, and triggering a cascade of damage. People with diabetes develop cataracts earlier and at higher rates than non-diabetic individuals. Managing blood sugar through diet, the reduction of refined carbohydrates and added sugars, is one of the most impactful things you can do for your long-term vision. Now I want to spend a moment talking about practical supplementation, because some of you may not have easy access to fresh bilberries. Bilberries are not as widely available as blueberries, particularly outside of Europe. If you are in a region where fresh bilberries are hard to find, look for standardized bilberry extract in supplement form. The research on bilberry typically uses extracts standardized to 25% anthocyanins. Dosages in clinical studies have generally ranged from 80 to 360 milligrams of standardized extract per day. Blueberries are a reasonable everyday substitute. They are in the same botanical family and contain many of the same anthocyanins, though typically in lower concentrations than bilberries. Regular blueberry consumption is associated with better cognitive and cardiovascular health as well, so there is no downside to including them generously in your diet. Black currants, elderberries, and acai are other anthocyanin-rich options worth including. If you want to do the before-bed protocol specifically, a handful of fresh or frozen blueberries, or a bilberry extract capsule, taken within 1 to 2 hours of sleep, is a reasonable approach. Combine this with a broader dietary pattern that is rich in leafy greens, colorful vegetables, healthy fats, and low in refined sugars, and you are creating an eye-friendly internal environment day after day. I also want to address something that I think is really important, and that is the psychological component of taking an active role in your health. When people feel helpless in the face of a condition like cataracts, when they believe nothing can be done short of surgery, they become passive, they wait. And while they are waiting, the condition progresses. When people understand that their daily choices, what they eat, how they sleep, how they manage their blood sugar, have a genuine and measurable impact on the tissues in their body, including their eyes, they become engaged. They become consistent. And consistency is everything in nutrition. No single meal, no single supplement, no single good night of sleep reverses years of accumulated oxidative damage. But a consistent, evidence-informed approach to diet and lifestyle creates the biochemical conditions for your body to do what it is designed to do, which is to protect and repair itself. The lens of your eye replaces its proteins very slowly. It does not have the rapid turnover of, say, your gut lining or your skin. So patience is required. This is a long game. But the evidence that nutrition matters for lens health is solid. It is not fringe. It is not unproven. It is supported by decades of epidemiological data, multiple randomized controlled trials, and a well-understood mechanistic basis rooted in antioxidant chemistry and ocular physiology. So to bring this all together, cataracts form primarily through oxidative damage to the crystalline proteins in your lens, compounded by inflammation, elevated blood glucose, nutritional deficiencies, and accumulated UV exposure. The lens depends on antioxidants, particularly glutathione, vitamin C, and carotenoids, to maintain its transparency. Bilberries, with their extraordinary anthocyanin content, provide targeted antioxidant support to ocular tissue, reduce oxidative damage to lens proteins, support glutathione function, and improve microcirculation to the tissues surrounding the lens. Eating bilberries or bilberry extract in the evening before sleep takes advantage of the natural nocturnal repair window when your body is most actively engaged in cellular maintenance. Combined with a diet rich in lutein, zeaxanthin, vitamin C and E, omega-3 fatty acids, and zinc, and managed blood sugar levels, this represents a genuinely evidence-supported approach to protecting and supporting your vision. Will it cure cataracts overnight? No. But it will create, night after night, the conditions under which your body is best positioned to slow their progression and support the health of your visual system. And that is something. That is real. That is worth doing. Before I let you go, I want to address a few questions that always come up when I discuss this topic, because I know some of you are already typing them into the chat right now. The first one is, what about sunlight and UV exposure? This is a really important factor that does not get nearly enough attention in conversations about cataracts. Ultraviolet radiation, particularly UVB, is a direct source of oxidative damage to the lens. Chronic UV exposure over years and decades significantly accelerates the development of cataracts, specifically a type called cortical cataracts that form at the outer edges of the lens. Wearing UV-blocking sunglasses is not a vanity choice. It is a meaningful, protective health decision. Look for sunglasses that block 100% of UVA and UVB radiation. Wraparound styles offer additional protection by blocking light that enters from the sides. This is especially important if you spend time at high altitudes, near water, or in reflective environments like snow, where UV intensity is significantly higher. Wearing a wide-brimmed hat further reduces UV exposure to the eyes. These are simple, inexpensive, and highly effective interventions that complement everything we have talked about today on the nutritional side. The second question I always get is about smoking. Yes, smoking dramatically increases cataract risk. This is one of the most consistently replicated findings in ophthalmic epidemiology. Cigarette smoke contains enormous quantities of free radicals and oxidative compounds that deplete the very antioxidant defenses your lens depends on. Smokers have rates of nuclear cataracts, the kind that form at the center of the lens, that are roughly 2 to 3 times higher than non-smokers. If you smoke, quitting is the single most impactful thing you can do for your long-term eye health, your cardiovascular health, your lung health, your overall longevity. No supplement, no matter how good, can overcome the oxidative burden of chronic smoking. I say this not to make anyone feel bad, but because it is true and because you deserve the full picture. The third question is about hydration. Your aqueous humor, the fluid bathing your lens, is predominantly water. Chronic dehydration compromises the quality and volume of aqueous humor, which in turn affects the nutrient delivery and waste removal that the lens depends on. Adequate hydration, typically 6 to 8 glasses of water per day for most adults, is a basic but genuinely important piece of eye health maintenance. Herbal teas count. Water-rich foods like cucumber, watermelon, and celery count. Caffeine in moderate amounts is not significantly dehydrating for habitual consumers. But alcohol, particularly in excess, does impair hydration and has additional negative effects on antioxidant status. The fourth thing I want to say, and this is probably the most important thing I will say in the entire lecture, is please keep seeing your eye doctor. Everything we have talked about today is complementary to, not a replacement for, regular professional eye care. Cataracts in their early stages often have no symptoms at all. By the time you notice blurring or glare or halos around lights at night, the cataract may already be quite advanced. A dilated eye exam can detect early cataract formation years before it affects your vision. Your optometrist or ophthalmologist can monitor the rate of progression and advise you on when intervention is appropriate. Early detection also matters because other conditions, glaucoma, age-related macular degeneration, diabetic retinopathy, can masquerade as or coexist with cataracts. These require specific treatments that no diet in the world will substitute for. I am not here to replace your eye doctor. I am here to help you understand how the choices you make every day either support or undermine the health of your eyes between your appointments. Think of it as your team.